So eyelid surgery entails either the top, the bottom, or both being performed at the same time. The technical name for it is a blepharoplasty, but that's kind of a complicated word, so usually we just go with eyelid surgery. In the upper eyes, you have two fat pads. One's close to the inside of the nose, and one's just a little bit on the outside of it. On the lower eyelid, you're gonna have three fat pads. Again, one close to the nose, one in the middle, and one on the outside. Not everyone needs those fat bags addressed, but some people, that's one of the first signs that they're going to see is sort of a fullness, especially in the lower eyelids. So when you perform that type of a surgery, you're going to be removing any extra skin or excess skin there. That's more common on the top or the upper eyelids. Frequently you'll see people who can almost pull their eyelids over their eyelashes, or they'll notice at the end of the day, their eyelid skin has all their mascara on it because it's been sitting on their eyelashes all day. So the procedure then removes that extra skin to restore a youthful crease above the eyelid. If it's needed, you would address the fat at the same time. And then for the lower eyelid, there are actually three approaches that you can use to address the fat bags that are there. You can do an incision where you go in the pink part of the eye called a transconjunctival incision. The benefit of that is there is no external incision, but it only addresses the fat bags. It doesn't address any extra skin or crepey skin that you might have there. The next incision, or the next approach, is an incision just underneath the eyelid margin called a subciliary incision. The third approach is a subtarsal, which is just a little bit farther down, and there's pros and cons to both of those, and depending on the individual patient, we'd recommend one over the other. But those are the ways you can address both the upper and lower eyelids. They can be performed at the same time, uppers and lowers, or just the uppers, or just the lowers, depending on what the patient needs.